Pregnancy and diabetes, why lifestyle counts. Pregnancy and diabetes presents unique challenges. Consider the goal, tight blood sugar control, and what you can do to achieve it. When you have diabetes, either type 1 or type 2, pregnancy presents unique challenges. Naturally, you're concerned about the effect diabetes might have on your health and your baby's health. There's much you can do to promote a healthy pregnancy, however. Here's what you need to know about pregnancy and diabetes, and delivering a healthy baby. Pregnancy and diabetes, your healthcare team. Your diabetes healthcare team likely includes an endocrinologist or other diabetes specialist, a diabetes educator and a registered dietitian. As your pregnancy progresses, your healthcare team can help you manage your blood sugar level and adjust your diabetes treatment plan as needed. During pregnancy, you might need to consult other specialists, including an obstetrician. Choose an obstetrician who handles high-risk pregnancies and has cared for other pregnant women with diabetes. Your obstetrician will carefully monitor your health and your baby's health throughout the pregnancy. An eye specialist. An eye specialist can monitor diabetes-related damage to the small blood vessels in your eyes, which can progress during pregnancy. A pediatrician. You might also want to establish a relationship with a doctor who will care for your baby after he or she is born. The goal, tight blood sugar control. Controlling your blood sugar level before and during pregnancy is the best way to prevent diabetes complications. Good blood sugar control during pregnancy can reduce the risk of miscarriage and stillbirth. Good blood sugar control reduces the risk of miscarriage and stillbirth, primary concerns for pregnancy and diabetes. Reduce the risk of premature birth. The better your blood sugar control, the less likely you are to go into preterm labor. Reduce the risk of birth defects. Good blood sugar control during early pregnancy greatly reduces your baby's risk of birth defects, particularly those affecting the brain, spine and heart. Reduce the risk of excess fetal growth. If you have poor blood sugar control, extra glucose can cross the placenta. This triggers your baby's pancreas to make extra insulin, which can cause your baby to grow too large, macrosomia. A large baby makes vaginal delivery difficult and puts the baby at risk of injury during birth. Prevent complications for mom. Good blood sugar control reduces the risk of high blood pressure, preeclampsia, which is high blood pressure that begins after 20 weeks of pregnancy, and other potentially serious pregnancy complications. Prevent complications for baby. Sometimes babies of mothers who have diabetes develop low blood sugar, hypoglycemia, shortly after birth because their own insulin production is too high. Good blood sugar control can help promote a healthy blood sugar level for your baby, as well as healthy levels of calcium and magnesium in the blood. Good blood sugar control also helps prevent a yellowish discoloration of the skin and eyes, jaundice, after birth. The action plan. Your diabetes healthcare team will help you establish your target blood sugar range. Then it's up to you to make healthy lifestyle choices and follow your diabetes treatment plan. Remember the basics. Check your blood sugar level often. Frequent blood sugar monitoring, at least 3 times a day, can help you prevent low blood sugar and high blood sugar, hyperglycemia. Remember, controlling your blood sugar level is the best way to promote a healthy pregnancy and prevent diabetes complications. Take insulin or other medications as directed. Although oral diabetes medications are sometimes used during pregnancy, your healthcare provider might recommend switching to insulin instead. Some medications, including certain drugs to treat high blood pressure, such as ACE inhibitors, should not be taken during pregnancy. Be flexible. You'll need to adjust your insulin dosage depending on your blood sugar level, what you eat, whether you're vomiting, and various other factors. Your stage of pregnancy matters, too. During the last 3 months of pregnancy, for example, hormones made by the placenta to help the baby grow can block the effect of insulin in your body. As a result, you might need more insulin than usual to counteract that resistance. Eat healthy. Your diabetes diet probably includes plenty of fruits, vegetables, and whole grains. Although you can eat the same foods during pregnancy, your healthcare provider or registered dietitian might suggest changes to your meal plan to help you avoid problems with low blood sugar or high blood sugar. It's also important to take prenatal vitamins containing folic acid. Include physical activity in your daily routine. Get your healthcare provider's okay to exercise, then choose activities you enjoy. Aim for at least 150 minutes a week of moderate aerobic activity. If you haven't been active for a while, start slowly. Check your blood sugar level before and after any activity, especially if you take insulin. You might need to eat a snack or adjust your insulin pump's basal rate before exercising to help prevent low blood sugar. Schedule regular prenatal checkups. Your healthcare provider might recommend regular ultrasounds or other prenatal screening tests to monitor your baby's growth and development. Labor and delivery, what to expect. Your healthcare team will help you determine the best time and safest way to deliver your baby. Sometimes labor is allowed to begin naturally. In other cases, labor may need to be induced early to reduce the risk of complications. During labor, your healthcare team will closely monitor your blood sugar level and adjust your insulin dosage accordingly. If your baby is too large, an induction isn't successful, or you develop complications, you might need a C-section. After delivery, your attention will turn to your baby, but it's still important to take care of yourself. Continue to check your blood sugar level often, especially if you're breastfeeding. Keeping yourself healthy is the best thing you can do for your baby. Preparing for pregnancy. If I have diabetes. If you have diabetes, the best time to control your blood glucose, also called blood sugar, is before you get pregnant. High blood glucose levels can be harmful to your baby during the first weeks of pregnancy, even before you know you are pregnant. Blood glucose targets are different for women who are trying to get pregnant. Targets are numbers you aim for. Pregnancy and new motherhood are times of great excitement and change for any woman. If you have type 1 or type 2 diabetes and are hoping to get pregnant soon, you can learn what to do to have a healthy baby. You can also learn how to take care of yourself and your diabetes before, during, and after your pregnancy. If you have diabetes and are already pregnant, don't panic. Just make sure you are doing everything you can to take care of yourself and your diabetes during your pregnancy. If you have diabetes, your pregnancy is considered high risk, which means you have an increased risk of problems during your pregnancy. You need to pay special attention to your health, and you may need to see doctors who specialize in treating diabetes or its complications. Millions of high-risk pregnancies, such as those in which women are older than 35 or carrying 2 or more babies, produce perfectly healthy babies without affecting the mother's health. Taking care of your baby and yourself. Keeping your blood glucose as close to normal as possible before and during your pregnancy is the most important thing you can do to stay healthy and have a healthy baby. Your healthcare team can help you learn how to use meal planning, physical activity, and medicines to reach your blood glucose targets. Together, you'll create a plan for taking care of yourself and your diabetes. Pregnancy causes a number of changes in your body, so you might need to change how you manage your diabetes. Even if you've had diabetes for years, you may need to change your meal plan, physical activity routine, and medicines. As you get closer to your delivery date, your needs might change again.